Bismillahirrahmanirrahim. Wassalatu wassalamu ala rahmatullahi alameen. Assalamu alaikum. I trust all is good and sound at your end. Today we are going to talk about the thyroid gland. It's a very important topic relevant to any medical licensing examination or even the clinical component of any medical license examination. So what is thyroid gland? Thyroid gland is an endocrine gland which is located inside the neck. It is a butterfly-shaped gland with two lobes. The structural and functional unit is a follicle, and there are numerous follicles which are filled with colloid. So what are the primary or fundamental requirements to synthesize T3, T4, the thyroid hormones? So first of all, of course, all of you must know we need TSH, and there are other enzymes like peroxidase, which is located found inside the gland, thyroglobulin protein. So all of this should be present and an adequate amount of iodine within the thyroid gland to synthesize these hormones. Then they have numerous functions inside the body relevant to the cardiovascular system, the nervous system, the GIT, and the liver for the uptake of LDL, low density lipoproteins. And of course, the metabolic rate can be affected by the concentration of thyroid hormone inside the blood. Now, one of the most important aspects is the pathophysiology in any endocrine gland, any disease relevant to the endocrine gland. So in terms of pathophysiology, either it can be a hypothyroid patient or a hyperthyroid patient or a euthyroid patient. And you should know what does negative feedback mean here. I can't go into details, but you can search for it, and if there's any questions or any queries, you can write down in the comment section. Now, before we jump into the pathophysiology, diagnosis and treatment, you would see a couple of case scenarios on your screen, and I hope you would be able to answer these scenarios once we're done with these points here. And you can just write down your answers in the comment section. Okay, now coming to the pathophysiology, a patient who is suffering from any thyroid disease either would present with a hyperfunctioning thyroid or a hypofunctioning thyroid. In terms of hyperfunctioning thyroid, the heart rate would be more, there would be weight loss despite adequate or increased appetite and heat intolerance. And there can be further presentations just like brittle hair, or restlessness, insomnia, and in terms of grave disease, exophthalmos, okay? So there would be periorbital infiltration of gags. And in terms of hypothyroid functioning thyroid gland, there would be decreased heart rate, bradycardia, or weight gain despite diet, despite the patient would say, I don't eat anything throughout the day, I am trying to control my weight, but there is still weight gain. So this is a classical presentation of hypothyroid gland and cold intolerance. So these are the usual presentation in a patient suffering from thyroid disease. The next step would be to just check the TSH, So if TSH is decreased or increased, so if it is decreased, so usually we would think of hyperthyroidism with this presentation, and then we would go for free T4. So the free T4 now, can be increased or normal or decreased. So if the TSH is decreased and free T4 is increased, now this is a case of primary hyperthyroidism. So what is primary means? There is the primary abnormality within the thyroid gland. And if there is decreased TSH with decreased free T4, then we would say there is a central problem. The central problem means inside the brain, usually the pituitary gland. So if there is a decreased TSH with decreased free T4, then we would say central hypothyroidism. Okay? Of course, the presentation that would be of hypothyroidism, not of hyperthyroidism. And if it's normal with decreased TSH, then it would be subclinical hyperthyroidism. In case of TSH, if it is increased TSH, then we again check the free T4. If free T4 is decreased, so this is primary hypothyroidism, just like Hashimoto's thyroiditis. So that is a classical example of hypothyroidism. And if you have normal with increased TSH, so that is subclinical hypothyroidism. So now, one more important point here is, for example, if you don't have this presentation here, not the clinical symptoms, but a patient comes with a thyroid swelling or a lump or a nodule, a thyroid swelling inside the neck. It can be diffuse. Diffuse here means the whole gland is involved, or it can be at a certain point, only one part of the neck, not diffuse, only one follicle or one part of the lobe is involved on one side. So in that case now, again, we would check TSH, and if TSH is decreased, so we would go for a radio uptake scan, okay, thyroid scan. And if TSH is normal or increased, then we go for thyroid ultrasonography. And then the features inside the ultrasonography, the report, that will decide either we go for observation or we need to do FNAC. Okay. So of course, if you have features that is pointing towards the malignancy, so then we go for FNAC. So it depends, of course, on the report, and we would have a separate, I guess, a video for this topic, but at least you should know all the points I'm mentioning here for undergraduate level for medical license examination. So now for diagnosis, we need to do the blood tests, and we can also go for a radio scan or photosonography. Now, if there is a primary hyperthyroidism case, classic example is Graves' disease. And Graves' disease, the specific test is to test for thyroid stimulating immunoglobulins, TSI. So this is a blood test we do for diagnosis of Graves' disease. And in terms of hypothyroidism, Hashimoto's thyroiditis. So we have antibodies against peroxidase enzyme or the thyroglobulin protein. So you should know all these investigations, the tests, and their interpretation, their relevant interpretation. So we have gone through a brief overview of the functional unit of the primary requirements for thyroid hormones, the functions, hypo versus hyper pathophysiology, the diagnosis, like what investigations we can do to diagnose a patient who is likely suffering from thyroid disease. And now the last one is treatment. Of course, for treatment, if there is a hypothyroidism, just like Hashimoto's, you need to give thyroid hormone, thyroxine. In case of hyperthyroidism, now it depends. What is the cause? For example, if the cause is Graves' disease, so first we might need to give anti-thyroid drugs to make it euthyroid. So euthyroid means normal functioning thyroid gland, normal TSH, normal free T4. Okay, so this means euthyroid. So if you need to intervene surgically, or you want to destroy the hyperfunctioning follicular cells inside thyroid gland through I-131 isotope, so in that case also, we need to first make thyroid gland euthyroid with antithyroid drugs such as carbimazole, methimazole, and PTU, propyl thiouracil. So you can remember from P stands for pregnancy and free stands for PTU. So if there is a pregnant patient who's suffering from hyperthyroidism, and you need to give a drug, so that drug of choice is PTU. In case of a non-pregnant patient or a male patient with the hyperthyroidism, you can give methimazole or carbimazole. But with antithyroid drugs, you need to monitor the liver function test and, of course, the CBC, the complete blood cell count, because sometimes the antithyroid drugs can lead to agranulocytosis. That means decreased granulocytes, decreased neutrophils. So that can be a matter of concern. So that's why you should monitor the CBC and the liver test. So anyhow, once again, I just went through a quick overview of the thyroid diseases. But anyhow, if you need to learn more about it, you can just say something in the comment section, and you can answer about the MCQs inside the comment section. You would just see the scenarios once again. Thank you.